Hi, I'm Amanda Stisher, and I'm currently a third-year medical student at the University of Alabama at Birmingham School of Medicine, and I'm in the Public Health and Policy track.
All right.
My project was using patient navigators to increase breast and cervical cancer screenings in the Alabama Black Belt. The women in these areas are very underserved. They have higher rates of cancer mortality, and we thought it was possibly due to a lack of cancer screening. They were more likely to be diagnosed with later stage cancer screening. So we train the navigators to go out into these communities and educate the women about the importance of getting the screenings done, and then schedule their mammogram and pap smear appointments and make sure that they kept those appointments. So our findings were we had some difficulty with making the appointments, but of the patients that we contacted and made their appointments, we had great success with getting them to keep their appointments. Mm-hmm. So we ended up having, we contacted about over 500 women, and we ended up having over 100 women have pap smears and almost 100 have mammograms. I would definitely encourage them to do the Emerging Leaders track. I think through this past year, I've grown so much as a person, and I feel like I can better help my patients because of that. I feel like I've learned how to be an advocate for my patients through going through this tract, and I think that is what we need in family physicians, that we need to be advocates for our patients.
So you
I feel like the network was very helpful and encouraging. I remember when I first got here, I was very intimidated because I started as a second-year medical student, and so I'm in this room, and a lot of the people that were going through the program were third, fourth-year medical students. There were several residents. They had a lot more life experience, a lot more clinical experience than I did. And one thing that stands out to me with I don't remember who it was specifically, but we all got in our groups on Sunday, the last day that we were here, to share our projects, come up with ideas, and I was one of the ones that was chosen to stand up and talk about my idea. And I was really nervous. Like I said, I was very reserved when I first came here, and one of the leaders came up to me afterwards and was like, "You have potential, you just don't see it in yourself." And that's one of the things that stands out to me, because when I was having issues with going through the projects and trying to continue my project, that was one thing that kind of just resounded in my head. Just, you have potential, you just don't see it in yourself. So I think that not only helped me with continuing my project, but it also helped me with gaining the confidence that I needed to become a better physician. I felt like going throughout the program, I developed a great relationship with a lot of the other scholars in the program. I feel like if I ever needed someone to talk to understand what I'm going through, because I feel like in my school there's not as many people going into family medicine as there were, and that was one of the most encouraging things when I got here, was being in a room with 30 people that also want to go into family medicine, and being surrounded by the faculty that have already been so successful in what they're doing, and it encourages me to also achieve, like these are the things that you can do in family medicine, that we can be leaders in our communities, that we can be leaders in a small scope, but also in a big scope, being like for the foundation as well. Yes, I've definitely enjoyed the opportunity to be able to come back this year and help the future class, the class behind me, and hopefully, maybe, if the foundation will allow me, I'd love to possibly be a mentor for the coming up classes after I do complete residency and become a physician as well.